So welcome, friends. So we will go through another success story of Aneesh Joshi, who has scored. Dr. Aneesh Joshi has scored CML and AML rank one. Congrats for becoming country's first in both CML as well as AML. And congrats again. How you feel now? And can you just introduce yourself? You're from Madhya Pradesh, right?
Yes, sir. Sir, I'm from Madhya Pradesh. My both my parents are doctors. My dad is a surgeon. My mom is a pediatrician, and I finished my MBBS. I'm from 2012 batch. MBBS I did from JIPMER, and MD 2019 batch I did my MD from SMS Jaipur, sir. Yes, sir. I passed my MD in May, mid July, sir. July.
Yeah.
Yes.
So, what was your basic plan? Whether you are preparing for INI or whether you are preparing for NEET or whether what was your plan when you are starting your preparation? When did you start actually serious preparation of entrance?
Sir, actually, the first half of my preparation, sir, actually started in January. Basically, I started watching your videos, and then out of those 120 videos, I was able to go through 60 videos, and by the April INI, I was done through half of the syllabus, sir. But I didn't revise those videos, and I didn't revise the handwritten notes which I had made. So, sir, I didn't get a very good rank at that time. After that, my basic aim was to I have to do INI. NEET was there, but that was just as a backup. And I wasn't as well prepared for this NEET also. So I wanted to prepare neurology. I wanted to do INI. Basically, sir, I was interested in medicine only because I wanted to go into neurology. Since I began medicine, I wanted to go into neurology. So then in between, sir, the July and August time, just before NEET, I wasn't able to prepare the core neurology part of it. I was going through Rakesh sir's videos. All the videos I went through, and then I revised them once, but the revision wasn't up to the mark, and I hadn't practiced MCQ, so that was one major lacking point. So I didn't get a very good rank in NEET. So, sir, after giving NEET in 2nd September, I started preparing for INI from around 5th to 6th September, and at that time, I finished the rest of your videos, all the pre-made notes which you had given. I went through all of them, all the extra points which you had made. I added those extra points in my copy, and I was basic. And then by the time the question bank came, I was able to go through the whatever modules which were uploaded, except two modules. I was able to go through all the modules, and then I bookmarked whatever questions I had difficulty in. And so then I basically all your syllabus, all those 120 videos, and the notes which I had made, I was able to revise it 4 to 5 times, and bookmarks I was able to revise once. So that was the basic plan, sir. So I corrected the 2 points which were lacking in my NEET preparation, sir. I didn't revise whatever I had read, and second was the MCQ practice. So, sir, that I focused on, sir, basically.
Yeah, that
Mhm.
is actually something like I was also telling during my modules also something known as metacognition.
Mhm.
Like when you are
Yes.
facing the exam, when you correct yourself through going through the exams, then you realize what is your where you lack and correcting it
Yes.
out. The exact thing
Mhm.
which made you reach the rank one. That too.
Mhm.
Now you are telling like your rank was not good, but right now nobody can have a better rank than yours. You are the first in the country right now. So that happens
Mhm.
when you correct yourself, like finding out where is a mistake and correcting it out. Very, very, very
Yes.
well done. And
Mhm.
right now, actually, when you are preparing for last INA and last NEET, right now there
Mhm.
is one difference which came up in the app is that you have a Q bank right now,
Yes,
and
sir.
detailed Q bank is there. And how
Mhm.
useful was that Q bank because you're preparing for last time as well as this time, and now you are
Mhm.
telling that you are going through more MCQs.
Yes,
So
sir.
how useful was it?
Sir, QBank, basically, I saw QBank as basically majorly two types of questions were there. One were basic conceptual questions which you had taught in the module. So that was helpful to revise. And so then there were some questions which were not there at all in what you had taught. And they were basically difficult questions. Some were factual questions, some were new conceptual questions. So that helped in two ways. So one was the first type of questions I was able to revise whatever you had told, and second questions that improved my guessing power, because obviously in 80 questions in INI we won't know most of the a lot of guesses we'll have to make. So that helped a lot in learning how to guess properly and how to rule out the other options. So that was very helpful. Plus, along with that, sir, you had mock tests were there for INI. So that was also helpful. So what I found was the mock tests which you had given in Marrow, they are usually of a higher level, sir. So that was helpful, because if you are practicing at a higher level, then the main exam will feel comparatively easier. and the more questions you go through, it normalizes the MCQ part of it more, so you won't feel as anxious on exam day as you'd be if you hadn't revised, sir. That's the thing.
And actually, like after the INSS, I and Rakesh sir was having a discussion that like
Hmm.
every year actually neuro questions are getting tougher and tougher every year. So
Hmm.
I think preparing at a higher level is something, at least for INSS, that is very much required, because
Hmm.
now this year question also is on a relatively very high
Hmm.
standard. Many
Yes,
questions
sir.
were very basic things like
Hmm.
physiology, anatomy. Then many
Hmm.
questions came from Bradley directly. Some like even
Yes, sir.
muscle biopsy one figure they are kept directly
Hmm.
from Bradley.
Bradley.
So
One tethered cord
oh,
syndrome was there
yeah.
directly from Bradley.
So
Hmm.
these all things, I think, like you need to have a higher level of understanding, and
Hmm.
I hope that for higher level of understanding, you need a concept, very strong concepts. So
Hmm. Yes,
I
sir.
think rather than just going through MCQ, the concepts plus MCQ will only
Hmm.
help, and
Yes,
just
sir.
going to the textbooks also won't help. You need to
Hmm.
have very strong foundation,
Hmm.
especially for neurology. I feel, because neuro questions are
Hmm.
every year it is getting tighter.
Yes,
What I
sir.
felt like
So
when you're
basically,
writing
what I
last year.
So basically, I wanted to say, so basically, it was the questions that at in this time the questions were like, some questions were very difficult, and some questions were very conceptual and very basic. So sir, it was a high risk, high reward game at that time. For all the questions which are very difficult, if you get them right, then it's good. But all those basic questions you can't afford to get wrong. If you make a silly mistake, that will cost you even more. So that was what I felt in this paper, sir. Like Parkinson's tremor, they asked which is the pathognomonic tremor. That is a basic question that you can't afford to get wrong. But if you that muscle biopsy question, if you haven't seen, if you leave it, that's still fine. That was the thing. So either they were very easy or they were very difficult. So like that it
Yeah.
was. Mm-hmm.
And many questions I felt, even like since last INA also same thing was there, even the NEET also same thing in neurology part. They
Mm.
ask something relative to the disease, but the question is more clinical. From the clinical,
Mm.
you will be able to rule out some options. Then you can make a good guess, even the question looks
Mm.
tough. Those things
Yes,
actually
sir.
keep on coming in neurology last few years. It
Mm.
always comes.
Yes, sir.
And how was the preparation when, like, how did you plan when, whether you are planning for going for a neuro or writing for INI or NEET while you are doing your PG? You did your PG from SMS Jaipur, right?
Yes.
So it will
Mm.
be a quite busy schedule there, right?
Yes, sir. So,
Especially in
sir,
the COVID
actually, I
time.
had. Yes, sir.
Especially in the COVID times, you will be
So,
having.
sir, so basically, it was I had already decided that I want to do neurology by the time at the I did MD medicine only to go into DM neurology, sir. Sir, but one regret which I have is, sir, in my COVID times we were actually working a lot of us, like we'll be working 2 weeks and then we'll be getting 2 weeks off. So sir, in those times I did not use properly, sir. I could have used those times properly, and then I could have tried for April INI also, but that was the time I didn't try properly. So that was one problem which was there in MD. I could have started earlier, so I would have gotten earlier, sir. So that is one thing, sir.
Like, what you want to tell to your juniors, who there will be two groups. One will be like those who are just joined the course, and second will be
Hmm.
those who are either going to pass out soon or just
Hmm.
clear the exam. So what do you want to tell them, how to go ahead, because you were decided to, you have the plan to take DM neuro, so you might have in your mind you want to write the entrance, you want to plan for it. So what do you want to tell them?
Hmm. Sir, first of all those people who are doing their MD right now, who are not close to passing their MD, first of all, I'd like to tell them that first of all, pick your subject quickly. If you are in your first year, see all the cases. See if you haven't decided which subject you want to do DM in, they have to decide quickly, and then they have to start preparing for INI, because sir, right now I feel INI is more is a more stable kind of exam, sir, compared to
Yeah.
NEET, because NEET they can ask anything. So preparing for NEET is actually very difficult, but INI is like you have to read. Suppose you are doing neurology, you have to read your core neurology. Whatever the syllabus is vast, but it is more defined compared to NEET, sir. So if you first of all you have to start preparation early, and then you have to spread out the preparation. You have to keep revising, sir. It's not like you can you can do even after third year, even after passing MD, you can do all this course. You can finish in 2 months, but sir, that becomes hectic, sir. I was at my home waiting for the execution of the bond in Rajasthan, sir. So I was getting a lot of free time, but not many people will get a free time. So sir, better to start preparation early and better to do it consistently, sir. So there is no time that you have to put more pressure, then less pressure, then more pressure, then less pressure, sir. So consistency has to be there, sir. That was very important, which I missed out on, I feel, sir. That is
And
there, sir.
what I feel is like when the time we were going for DM and all, like we were writing the
Hmm.
exams. I wrote the first NEET exam, NEET SS,
Okay.
and
Hmm.
at that time there was no specific plan per se. Like the thing was like a new NEET pattern has come up, and there was nobody to guide us. There
Hmm.
were Marrow and similar apps were there for UG, like for MD
Hmm.
exams, but there was nothing was there
Hmm.
for super speciality. So right now there is
Hmm.
in the market there are so much available sources are there. So how
Hmm.
useful was Marrow per se? Like how did you use it during your pre exam time, and
Hmm.
you started from Jan, right? So
Yes, sir.
how did you use it whether like at least during the last few months,
Hmm.
because you need to revise, you need to do MCQs. How did you plan it?
So, sir, what I did was I did not read any proper textbooks, sir. Harrison, I did not read properly. Bradley, I did not open. Everything for my preparation was your videos, your notes, and sir, the Q bank, sir. So, sir, that was there, and so, sir, that's what I started in January. Did half the syllabus, then did rest of the half of the syllabus in September. Then revised that syllabus 4 to 5 times. Then did the Q bank, and so then instead of reading Bradley, because that's just not possible, sir. At least for me, that wasn't possible. Even for people who would be starting first year, also, if you reading Bradley, retaining Bradley will not be possible. So what I did was the Bradley review book, which is there. So that has 6 tests, sir. Each test is 105 questions. So I kept I did all those tests. I was seeing what score I was getting. I was consistently able to get around 80 correct out of 105, sir. And rest of the questions, there were very important conceptual explanations were also there in Bradley, sir, in that review book. So that was very helpful, sir, for obscure topics like, sir, Hunter syndrome and Hurler syndrome, how it relates to neurology, other types of peripheral neuropathy, some basic concepts, and that I added to your notes, whatever notes I had made. And that was, in the end, I was able to revise that, and that was very helpful, sir. So your videos, notes, and then Bradley review books, sir, that was very helpful, sir. Yes, sir.
And like you were telling that you after passing out your MBBS, only you want to take DM neurology. So what was something which pushed forward towards DM neurology, or taking out neurology as a subject? Because your father being a surgeon, like
Hmm.
what made, because neuro is more of medicine, more
Hmm.
clinical, and surgery is on another extreme. So
Hmm.
what made you like neurology before entering into MD?
Okay, so neurology. So first of all, the neurology part is I like the logical thinking of it. So it's not like a straight logic like cardiology. It's more of a jumping logic, I feel, sir. Like some concepts are there, then some is unknown, then some concepts are there, then some is unknown, and you have to, the basic fundamental neurology is you have to figure out what is unknown, sir. So entirely new concepts can be made. So overall, it's a very open field, sir. So I was very attracted to all neuro parts. And regarding medicine, sir, I was actually I initially joined surgery, sir,
Oh,
thinking that I will go into neurosurgery. But doing surgery, I realized that surgery is more of therapeutics, and I was more inclined towards the diagnostic part of it, the history and examination, and figuring out what is wrong with the patient, and then going to the therapeutic part of it. So I left surgery and joined medicine, sir, to go into neurology, sir. So that was it. Plus, I was very interested since lot of times, sir. I was reading Phantoms in the Brain, V.S. Ramachandran, Telltale Brain,
obviously.
all those neurology books, Oliver Sacks. So I was very interested in all of those. So those also got me interested more in the subject, but those solidified my interest in the subject, sir.
Yeah, actually, when you have interest in cognitive neurology, when once you
Hmm.
get interest in cognitive neurology,
Hmm.
that is something which is a core neurology part. You will slowly like the neurology and you will deviate toward that. And
Hmm.
what was your plan? Like if you were writing for NEET also, no? So how did
Hmm.
you plan for your NEET exam? Like whether you
Hmm.
were studying only for INI, or you have
Hmm.
plans either NEET or INI? like any institute options you were keeping in your mind before
Sir,
this exam?
actually, okay, sir. Actually, NEET I prepared for 2 months, but that preparation was, as I said, that preparation was not up to the mark. In that also, I focused on neurology because I knew that right after NEET, I have to get into the INI preparation, because even if I get a good rank in NEET, I wouldn't want to take a college through NEET. And this is why, sir, actually the NEET registration for the counseling actually ended on 28th. So I didn't register for it, sir. I got a bad rank, but I didn't register for it also, so that just in case if I don't get in this I shouldn't have a second option. Then I am forced to prepare for the next INI, sir. So this is why I didn't apply for NEET counseling, sir. So I wanted to
And
do INI. That's there.
so, like many students keep on asking me, like, how much amount of Bradley should I read? Should I read? Like, I'd gone through Bradley 2 times. I'd gone through Harrison 3 times. So, what
Hmm.
I feel is always, if you, it's like reading textbooks and knowing it is very good, but you cannot page by page, scene by scene, you cannot mug up things. That is almost
Hmm.
impossible because this
Hmm.
is not an MBBS exam. This is a
Hmm.
post MD exam. The stuff
Hmm.
and the details you need to understand is too so much vast. No brain
Hmm.
can hold that much things. Even
Hmm.
if you study that much, it may not be beneficial. And if you
Hmm.
read the entire Bradley, even if after passing out my MD in my DM, and I was reading and I was reading again for preparing for Marrow because I had to fresh up myself.
Hmm.
Even after that, I'm 100% sure that I had not read the entire Bradley, because even if
Hmm.
I read 100% of Bradley, it is not complete. Like, see,
Hmm.
neurology, there is a lot of specialities. If you
Hmm.
take epilepsy, very small
Hmm.
amount of epilepsy has been discussed in Bradley, and if you
Hmm.
take movement disorder, it is very much less. So even the
Hmm.
stroke,
Yeah.
the newer things, newer management, anatomy, nothing is there in the Bradley. So no
Hmm.
textbook is perfect. So textbook is,
Hmm.
it is not an exam to know that how much amount of Bradley or how much amount of
Hmm.
Harrison you are. It is about the how much knowledge you know, how much concept you know. That is what we
Hmm.
want to assess. So
Hmm.
I think what you're telling is really correct. Like, it is impossible task to go through a textbook and by hearting it
Hmm.
and delivering it. It is impossible. It is well and
Hmm.
good. It is, you should read your textbook. You should know the textbooks properly. That is well and good. But for entrance
Hmm.
and for exams, that is not just Bradley or just Harrison. This is something which is the
Hmm.
neurology or medicine you need to understand.
Hmm. Yes. So, sir, what I feel was like, if suppose we are doing Bradley, even if we are reading Bradley, matlab, suppose Harrison or Bradley you take, even if you are reading it, it can confuse you even more, because they are a collection of studies, and they don't tell what to do. They just tell ki what has been found in these studies. So you might get even more confused. So, sir, what actually clears those confusion is actually practicing the MCQs and seeing how they apply it to in real life, and how they apply to case scenarios, and how you do. So, sir, application part will not come from just reading textbooks, is what I feel.
Yeah, actually,
It decreases.
if you take your LGMD or your muscle dystrophy portion,
Hmm.
Harrison has even the inflammatory myopathies. The new things, Harrison, it is there. It is in one
Hmm.
table. If you by
Hmm.
heart a table, you won't understand the concept. You can by
Hmm.
heart a table, and you can answer that gene number, this one, that one, but you don't have the
Hmm.
concept. A question
Yes,
comes in another way. The round the way question comes, you cannot answer it. So you need to
that's
know
true.
the concept. That, and again, like you tell, like you just told, like, you go to the stroke and take the treatment aspect. If you go through that, you will read lot of 100 studies is there. At the
Hmm.
end, you will not remember even the name of the studies.
Yes,
Even
sir. Hmm.
when I was doing my MD, I still remember I was going to the Harrison, reading page by page of Harrison or the stroke manager. There's a lot of studies. At the end, I was not understanding which one I have to follow. That was the first question came to me.
Hmm.
Yeah.
So that's why it's helpful, sir, because you are actually practicing neurology. You are a DM neurology, sir. So you are practicing. So you will put your experience also into it and see if whether you separate the wheat from the chaff, basically, sir. So it's like that. So that is helpful, sir, to be taught by someone who is actually practicing the subject, sir. Yes, sir.
Yeah, that is something like actually students now are really, like, those who are preparing for exams. They are actually really lucky. Like, when our time, it was very difficult.
Mm.
You
Yes,
don't
sir.
know what to study, where to read, and what to
Mm.
read. Nothing. Everything
Mm.
was confusion for us. And
Yes, sir.
what is your plan? Like, which place you want to take in Delhi AIIMS, right?
Sir, I'm actually confused, sir. Before this, I thought I will take NIMHANS Bangalore, but now I'm getting confused whether I should take AIIMS or whether I should take NIMHANS. So, sir, I'll have to see that because NIMHANS I'll have to learn Kannada also. I know a little bit of Tamil because I did my MBBS from JIPMER, but Kannada is a whole new language. So,
Actually,
sir, that those. Hmm.
I was in immense, like we had 4 months posting in immense.
Okay,
There
sir.
actually all the languages comes Kannada, Telugu,
Hmm.
Bengal, everything
Hmm.
comes there.
Yes, sir. So, sir, that I'll have to see the pros and cons and decide, sir. Right?
I don't know.
I
I
was
don't know
more.
how much it is in the AIMS. Like
Hmm.
uh, for neurology, the language is one thing. Like you need to take
That
a
is
proper
yes, sir.
history.
Hmm.
History is the basic stuff, basic root of neurology.
Hmm.
Without history, you're gone. You're gone blank.
That is. Hmm. And this is why I was interested in neurology. So, sir, I'll have to weigh the pros and cons of both the institutes and have to decide. So, both are excellent, sir. So, it's like,
Yeah, both are excellent.
yes, sir.
And both has
Hmm.
its own pros and cons. Like you can talk to somebody who has done DM from AIMS and somebody who has
Hmm.
done DM from immense. Then you will, especially somebody who is non Kannadiga, because
Hmm.
those who are and from Karnataka, it will be easy for them to do in immense because they know Kannada and they can practice it. So you have to ask both the so find someone and ask. If I know, I'll suggest you someone. I know few
Okay, sir.
studying in immense, yeah, and few studying in AIMS. You can talk
Okay,
to
sir.
them and then finally decide because this is some of the
Hmm.
crucial decisions because you have
That's
got
true.
the rank one, you have the capability to select whichever you want, you can select it. So
Yes, sir. Hmm.
and how is your family? Everyone, father, mother, everyone is very happy, right?
Yes, sir. They are very happy and proud. I was actually not expecting, sir. CML, I was thinking कि maybe I can get a good rank. I wasn't expecting a good rank anyway. But AML, I wasn't expecting at all, sir. So that was a pleasant surprise, sir. My
How was the
interview was
phase
also
two?
not. Yes, sir.
How was the phase two? Like I forgot to ask about that. What was the phase two?
Sir, phase two, sir. First of all, phase two preparation, I was not able to be as thorough with the phase two preparation. I just read the approaches to basic, like approaches to stroke, paraparesis, muscle weakness, or hand wasting. But phase two was okay, sir. I thought my interview went average. So I wasn't actually expecting that they will give me 18 out of 20 in interview. It didn't go as good, sir. So I wasn't expecting that, sir.
Actually, nobody can prepare for phase two. I was telling it in the phase two
Yes,
preparation
sir.
session.
Yes, sir. I attended the session, sir. Yes, sir.
Phase two is basically they can ask anything, but I was expecting the same thing. Like they will ask some clinical scenario, ask for
Hmm.
approach and how to deal with the things.
Hmm.
That's the
But
only
the
thing.
questions were basic, sir. Questions they ask very basic. All the difficult part and all the complicated part they leave for theory, and then phase two they ask all the basic, whatever we'll use as a DM neurology. That only they ask, sir. Yes, sir.
So right now, we are also like you're telling your father and mother is proud. We are also proud and we are also happy
Thank you so
that.
much, sir. Couldn't have been possible without you, sir. Not at all,
Thank,
sir. Hmm.
thank you so much. And if like I have helped you at least 1%, that is,
Hmm.
I was telling it was last day also. Like
Hmm.
99% is something which you have done, and only we have done only
Hmm.
1%. You just
Hmm.
provided something, and you approached it properly and prepared it
Hmm.
nicely, and you
Okay.
have your own plans. That is something which has helped you.
Hmm. Thank you, sir. Thank you, sir.
And what is your plan like after this? Like any plans? Like many of those who choose neurology nowadays, they will like some of the subspecialty of neurology. They want to go to
Hmm.
that, and some of them
Sir,
take IMA because of that.
hmm. Sir, for postdoctoral fellowships, I was thinking about. I had actually narrowed down 4 subjects, sir: pediatric neurology, cognitive neurology, stroke, and epilepsy, sir. So among these, I want to specialize more. I was more leaning towards first of all pediatric neurology because that will expand the types of patients I will see, sir. And pediatric neurology is a completely different ball game compared to adult neurology. And second is cognitive neurology, so that I'm very interested in all the dementia part and everything, sir. So that I'm very fascinated by, sir. Yes, sir.
Yeah, but practically speaking, cognitive neurology. Even I love cognitive. And I was telling it during so
Mm.
many presentations also. My favorite area is cognitive neurology, but cognitive neurology, practically cognitive neurology, various limitations are there. That is the problem with
That
cognitive.
is. Mm.
But it is the most interesting part of. I knew that you had gone through SARS book and all, like you were telling Oliver Sacks and all.
Yes, sir.
You definitely will have inclination towards Adarshans as books, right? And
And Ram.
you definitely have inclination towards cognitive neurology.
Yes, sir. Yes,
So
sir. Mm.
so all the best for the future, and you definitely going to rock. And you decide with like, if I can provide you some of the PGs who has done from Nimans or AIMS. I will give you the
Mm.
numbers. You can contact them, and
Thank you so much.
you can decide
Mm.
which you want to select, and just let me know also which area, like whether you're going to AIMS or whether you're going to Nimans,
Okay,
and keep
sure,
in
sir. I will let you know, sir. I'll keep in touch also, sir. Mm.
all
Thank you
the
so much.
best.
Thank you so much, sir. Thank you.